when I do meet with our stores and let them know, hey, EQUIPP has this text message reminder program where they will alert you to those opportunities when they come your way. And the most common response that I do get is, absolutely, I will take all of the reminders that I can get. So I think, from hearing directly from stores, those touch points just helps increase the engagement overall and ultimately helps their patients in maintaining their health medications and their medication regimens.
Welcome to the Pharmacy Quality Solutions Quality Corner Show. Buckle up and put your thinking cap on. The Quality Corner Show starts now. All right. Hello, Quality Corner Show listeners. Thank you all for joining us today. Today's edition of the Quality Corner Show, we do have Miss Claire Schrunk with us. She is a pharmacist coming with us here from the EPIC Pharmacy Service Administrative Organization, or PSAO. Claire, thank you for joining us today. We are so happy to have you on board. I'm going to let you introduce yourself and give us a little bit more about what you do there at EPIC. Give us your title, your background, and what you're going to talk to us about today.
Yeah, absolutely. So thank you guys for having me on today. My name is Claire Schrunk. I am the Clinical Programs Director at EPIC Pharmacy Network. A little bit of background about me. So I graduated from Virginia Tech. I went to VCU Pharmacy School here in Richmond, Virginia. Throughout my pharmacy school time, I worked as a technician, intern, pharmacist for a large chain. And so I've been very familiar with the day-to-day tasks of what pharmacists go through. During my time in the retail setting, I was a floater. I was a staff pharmacist, so I'm very familiar with what independent pharmacies go through and how I can help most effectively utilize my experience and my knowledge to help our independent pharmacies.
Thank you so much for that background there, Claire. And you giving your background, let me realize I failed to give mine. Brittany Boyd, Senior Manager of Pharmacy Training and Support here of PQS by Innovaccer. And as you mentioned, Claire, you work directly with the pharmacies and ensuring that they have the assistance they need on the independent side. And so PQS, we are allowed to do that by empowering pharmacies by utilizing the EQUIPP platform to have that. And so throughout today's discussion with Claire, we are going to review what are some ways that the pharmacies there with EPIC actually are utilizing EQUIPP. So are you able to provide us with some feedback of how EQUIPP has actually helped your pharmacies drive their business success?
Yeah, absolutely. Thank you for that question. So I do want to provide a little bit of additional background context from when I first started my role to kind of where we are now. So I will be completely honest with you. I was not aware of a lot of the details surrounding adherence measures and, all of those details involving the components of the clinical aspect. For example, PDC scores. I had absolutely no idea what those were. I had never heard of those before. So it did take a little bit of time, just kind of researching and figuring out exactly how I can be the most effective in my role. And I will say EQUIPP has helped me tremendously in kind of taking those components that I had researched and helping kind of put all of the missing pieces of the puzzle together to where I can then, most effectively communicate that information to our pharmacies in, a very just clear and concise way. And I will say I am very, very, very excited to share that, over the past 16 months, we have increased our store login percentages by about 125%. I'm very excited to share that with you guys today.
Yes, those are fantastic statistics. And Claire, if I may, I'll actually have to be able to share with you some transparency there. I can relate of not fully knowing the true depth of how important quality
Right.
measure performance is and really understanding that PDC rates make such an impact, not just only with your performance in the pharmacy with our health plan partners of you being able to make sure that those scores are really achieving the goal expectations from health plans, and we know making sure that they are seeing you in that positive light in the pharmacy, that hey, you're taking care of your patients in the right way, right? But also ensuring that your patients are achieving their health outcomes, right? And that's a really strong benefit to those PDC rates. And having been at PQS now those past 6 years, I've seen such great results in being able to utilize the EQUIPP platform and having that insight to that information and the quality measurement details that are really there. And we've now kind of expanded past that and into enhanced services opportunities and other things that are there. But what are some things that you would describe are the biggest benefits that EQUIPP brings to your pharmacies and to EPIC as an organization?
Yeah, absolutely. So I think definitely from a financial perspective, every single penny is absolutely crucial to independent pharmacies, especially in, the current landscape that we're in. And the pharmacies that utilize Equip, they reap the benefits from that. I'll give you a few examples. So, I've had a few stores tell me that they were actually able to keep their pharmacy doors open, from taking advantage of these opportunities and really utilizing Equip to increase their adherence scores. And I think also from, a patient perspective, implementing programs like MedSync and, auto refill, not only do those help the adherence scores, but they also, increase patient satisfaction. And ultimately, pharmacists, we are here to help serve patients and optimize their health and their medication regimens.
That's a very, very good fact there, Claire, that knowing that the financial aspect to the pharmacies and that impact is very big. We are now on the other side of the final rule, and we're in a no longer in the post DIR world. We're seeing it now on the forefront, no longer on the back end. And so trying to understand, how the way the pharmacies can further engage with their patients and utilizing EQUIPP to do so is really impactful. So it is fantastic to know and to hear that pharmacies are able to keep their doors open by doing what they do best, engaging with their patients and utilizing EQUIPP to do so. And so, the additional enhanced services programming that we offer through EQUIPP now through the adherence monitoring program, you really called that out when speaking of the MedSync and those auto refills that are already being put into play. And again, making sure that they are doing well on those quality measures and ensuring that they're achieving those goals that are set there. The other additional programs that are now available, like controlling blood pressure and A1C testing that could potentially be available through EQUIPP. How are your pharmacy staff addressing, being able to complete those opportunities through enhanced services and EQUIPP?
Yeah, absolutely. So I'll give a few different examples of some, direct feedback that I've heard from speaking with our stores and what they are doing to implement these enhanced service opportunities into their workflow. And I'll just use the controlling blood pressure program as an example. So, number one, printing out the list of eligible patients and placing that list at different, workflow stations at their pharmacy, whether that's at pickup, at drop off, at the pharmacist station or in the counseling room, just having those different touch points and increased engagement from the pharmacy staff, that just helps at the end of the day kind of hone in on the importance of enhanced services. Number two, when pharmacists are verifying prescriptions, they check that list of patients and they'll actually write on those receipts, blood pressure check, or they'll post a sticky note on that receipt. That's another touch point there. Third would be, putting a note into the computer system. So that way, when the patient comes to pick up their prescription, that note will populate, alerting that pharmacy employee, hey, this patient is eligible for a blood pressure reading there. And lastly, I think this is absolutely huge, is definitely taking advantage of the text message reminders that Equip does offer. Now, I do have a funny side story I just want to share really quick. So, I actually signed up our CEO's pharmacy for the enhanced or for the text message reminders. And I get a call a few minutes later, and he's like, Claire, was this you? And I said, it sure was. Let's get to work. But in all seriousness, when I do meet with our stores and let them know, hey, Equip has this text message reminder program where they will alert you to those opportunities when they come your way. And the most common response that I do get is, absolutely, I will take all of the reminders that I can get. So I think, from hearing directly from stores, those touch points just helps increase the engagement overall and ultimately helps their patients and maintaining their health medications and their medication regimens.
That is fantastic feedback, Claire, and really great to hear some of those actionable steps that your pharmacies are taking, from printing out the list. The text messaging is huge. I do love that you sign up your CEO for text messaging. I think that's super actionable. I think it's helpful. So I'm going to ask you something that is kind of just off the cuff here. When we
Yep.
think about prioritization and just ensuring that the pharmacies are engaged and printing off those lists, when we have that information in the enhanced services page where they can very clearly see, hey, make sure that you have this done by this date, or making sure that, that those fills are completed in that timely manner. Are you getting direct feedback from your pharmacies, where they're saying like, hey, we were able to make sure that we got this in by then. We're seeing those revenue dollars continuing to come in. I'm sure that you are getting that type of feedback, considering that they're able to keep their doors open, but just really would love to hear some feedback. And I'm sure all of our partners would love to hear just from, that, because we hear, the time constraints, right? We know that the pharmacies are typically super overwhelmed with the patients coming in, the amount of staff that they have, but having those dates and just knowing you need to be able to have something completed by a certain time, is that beneficial for the pharmacy? And will that help them maybe prioritize their efforts a little bit better?
Oh, yeah, absolutely. And I think it's also just human nature. When you have a set date that you need to complete something by, you make it a goal to get that accomplished. So I think that that is absolutely key as well. And then just having, those reminders from not just the text messages, but also having other employees in the pharmacy, whether it's technician, intern, another pharmacist, having, everyone kind of engaged in the overall picture, is the key to success.
Thank you, Claire. Those are super helpful tips that you gave us from prioritization, making sure that everything is in line and ensuring that the pharmacies have a way to engage better with their patients. So how else would you suggest that our pharmacies drive further success with blood pressure readings, or taking A1C, having A1C readings taken in the pharmacy?
Yeah, absolutely. So I think that pharmacies that have Higgy machines, for example, I think utilizing those are super important. The patient comes to pick up a prescription, the technician or the pharmacist can walk them over to the Higgy machine, get the reading, document, kind of move on from there. I also think this may not be the most, popular way, but I think just the good old fashioned cold calling patients, hey, Miss Smith, next time you're in the pharmacy, let's get your blood pressure checked, to ensure that your therapy is still appropriate and you can address any concerns, that you may have there. And of course, we are in vaccination season. It is well underway and it is not slowing down anytime soon. I think this is another great opportunity to really maximize those enhanced service programs. When a patient comes in to get a vaccine, they can review that patient list that's already in the counseling room, and you can knock out two birds with one stone there. So I think those are also additional ideas that pharmacies can implement moving forward.
Really awesome feedback there, Claire. Thank you. And those are, again, very actionable steps they can take. So, when we talk about our bonus questions here, just have some other follow up for you. I want to know, how do you suggest, or other words of advice that you provide to others to either get started in EQUIPP, or even improving when it comes to, again, quality measures, enhanced services? You gave us some really great key tips here today. So, really interested to hear from you. What are some other words of advice or words of wisdom that you can give to our audience?
Yeah, absolutely. So I think hands down, my biggest piece of advice is to just have a general understanding of the, foundational components of adherence. I think sometimes adherence has a misconception that it doesn't matter, but in reality, that is just not the case. It does matter. I've seen situations where pharmacies may try to implement, two, three, four different avenues to help increase their bottom line, when really, focusing on that adherence component and utilizing EQUIPP to do that could help them get there, just as easily. And of course, taking advantage of those enhanced service opportunities as well.
Fantastic. My next question for you here is going to be just wanting to understand from you, what would you say to a health plan if you could? If you had one opportunity to sit down with the health plan and give some feedback, what would that look like?
Yeah, absolutely. So I think there are three components that really make up a meaningful and sustainable quality program. in no particular order because I think they are all three equally as important. But I would definitely say number one, having reliable and consistent data. Number two, the program must be easy and intuitive for users to use. Number three, the incentive component also must be there. Pharmacists are superheroes and they deserve to be treated and rewarded as such. And, when pharmacists are in a good position, the patients are also in a good position. And then from there, the plans are also in a good position. So it benefits everyone. It is all connected. It is all a chain reaction. And that really starts with that community level feeling between the pharmacist and the patient, to where it then also benefits the health plan. But just having a very simplified and easy way to implement these quality programs is absolutely key, in my opinion.
And that simplified and easy way is using EQUIPP, right, Claire?
That's
What I
right.
heard. Yeah.
That's right.
And also in using EQUIPP, ensuring that, like you said, the data there is accurate, it's timely, it's efficient, it's easy to use, it's easy to understand. That's the
Right.
same way that we want the programs to be consumed and to be utilized by our pharmacy partners. And just want to again call out for those enhanced services opportunities that we're hosting in EQUIPP, ensuring that for adherence monitoring, to your point, Claire, those things are being prioritized and done by those specific dates and documented, and that we are completing those fills in that timely manner in EQUIPP, that we are, or in the pharmacy, but also then documenting in EQUIPP. We are doing the same for controlling blood pressure and ensuring that we are getting that blood pressure reading via any electronic method. So you called out the Higgy machine, but also knowing that you can do that with any other, if it's an electronic blood pressure monitor you have in the pharmacy, you can use those things, and just making sure that you are documenting within that window that's appropriate and available. Make sure you have that accurately in the dashboard. A1C readings, making sure again that you're getting those values, you're documenting, you're putting that in there, and you have that additional incentive that's tied back to you in the pharmacy. To your point earlier, you called out the pharmacies being able to keep their doors open. They're able to earn additional revenue back by simply engaging with the platform and having that information saved. And so the entire pharmacy staff can get involved with that, and using EQUIPP is the method in which to do that in. And like you said, the health plans get the additional benefit from being able to see us engage. And that's the way that we keep these programs alive and well, is having very talented and amazing pharmacists like yourself and your pharmacies that you represent there, EPIC, and other staff members that are participating and continuing to contribute to the positive patient health outcomes you guys are impacting every single day. So it is fantastic the work that you guys can do and continue to do. It is honestly immeasurable. And so we just really thank you for your continued partnership here. Are there any closing remarks and comments you want to provide, Claire, to our Quality Corner podcast show listeners and audience here before we wrap up?
Yeah, I just want to say thank you for having me on here today. I love having these conversations and getting out, any message that I can. If I can help just one person, then I have done my job. If anyone has any questions, I am on LinkedIn, and you could always shoot me an email to clinicalprograms@epicrx.com. I will be happy to help you out there.
Thank you so much, Claire. And thank you to our Quality Corner show listeners. Again, I am Brittany Boyd with PQS by Innovaccer. Thank you all for joining today, and hope you join us again next week. The Pharmacy Quality Solutions Quality Corner show has a request for you. Our goal is to spread the word about how quality measurement can help improve health outcomes, and we need your help in sharing this podcast to friends and colleagues in the healthcare industry. We also want you to provide feedback, ask us questions, and suggest health topics you'd like to see covered. If you are a health expert and you want to contribute to the show or even talk on the show, please contact us. You can email info@pharmacyquality.com. Let us know what is on your mind, what we can address, so that you are fully informed. We want you to be able to provide the best care for your patients and members, and we wish all of you listeners out there well.